Okay, so how do you assess a patient for nutrition in surgery? For that, you have to calculate these four things. What are these four things? These four things include mid-arm circumference, then we have the triceps skin fold thickness, and then we have the body mass index and serum albumin. Of all these four things, the serum albumin is the most important factor in the assessment of nutrition in a surgical patient. Okay, now what is malnutrition universal screening tool? It is a universal tool which is used clinically in order to assess a patient for malnutrition, and it is based on three factors. Number one is BMI, then we have the weight loss in 3 to 6 months, and then we have the acute disease effect. So if the patient's BMI is more than 20, then the score of that patient will be 0. If it is between 18.5 to 20, the score will be 1. And if it is less than 18.5, the score will be 2. Now, if the patient has less than 5% of weight loss in 3 to 6 months, the score will be 0. And if the weight loss in 3 to 6 months is between 5 to 10%, the score will be 1. But if the patient has a weight loss of more than 10% in 3 to 6 months, the score will be 2. Now, what is acute disease effect? You have to add a score of 2 if there is reduced intake for more than 5 days. This means that you will add plus 2 with the score obtained from these two values if the patient has reduced intake for more than 5 days. Now, what are the indications for artificial nutrition? So, any patient who has sustained for more than 7 days of inadequate intake, you have to start that patient with artificial nutrition. Now, another indication for artificial nutrition is that if you are anticipating that the patient will have no intake for the upcoming 7 days, you will also start that patient too with artificial nutrition.